Hi, I'm Dr. Christopher Mullane, and today I'd like to share with you the most common causes of low back pain, and in my experience, the best ways to alleviate that. Now, low back pain typically occurs due to two reasons. Now, that would be major trauma and minor trauma. Now, major trauma would be something like a fall or an injury or even a car accident, where minor trauma would be more of your repetitive motions, excessive turning, bending, lifting, or even excessive sitting for long periods of time would be classified as a minor trauma. Now, when we have a low back injury, there are typically three areas that get injured, and that being the joints in the low back, the nerves, and then the disc associated in the lower region as well. Now, let's first talk about the joints. The joint is essentially where two bones come together, and when everything's working properly, you'll be able to move freely and not have any discomfort. But when the joint gets restricted or irritated or injured, essentially, it's not functioning properly, and that's going to produce some pain. It's going to have some associated muscle spasms or muscle tension, and you just won't be able to move as freely as you normally would. Now, also in the low back, you can get injured through the nerves. You can get pressure onto the nerves, you can get a pinched nerve, and the nerves in the low back, they originate there and they travel. They travel down the leg and actually can go down into the toes as well. So the more pressure you have onto the nerve or the more the nerve is pinched, the farther down your leg you may feel it. So we commonly see pain in the low back and referral down the leg. And then finally, the disc. The disc is essentially where it separates the bones in the low back and acts like a little bit of a shock absorber. Now, commonly we see injuries in the form of a disc bulge or a disc herniation, where that disc material is putting pressure on the surrounding structures. Now, that disc pressure will, again, it'll create, pain and discomfort essentially, and then you'll also have, restricted motion. You won't be able to move as much without that disc putting pressure on the areas and stopping you from moving freely. So essentially the most common symptoms we see, whether it's an injury in the low back due to the joints, the nerves, or the disc, it's going to be pain. And there's a lot of different pain patterns that can occur. It can be achy or stiff or sore. It can be sharp or burning even. That's one of the most common things we see. But we also see some associated muscle tension and muscle spasms. And then finally, restricted motion. You're not going to have the same range of motion that you normally would if you didn't have an injury to the low back. Now, in my experience, we have three effective treatments that really help in reducing these problems that you're experiencing in the low back. So essentially, the first being chiropractic spinal manipulation, the second being electrical muscle stimulation, and the third treatment being intersegmental traction therapy. Now, first, let's talk about the chiropractic spinal manipulation. Now, this is applied in a very specific manner to affect the pressure in the low back. It can alleviate the pressure on the joints, the discs, or the nerves, and now you won't have as much pain. You'll be able to move a little bit easier, and you won't have that associated muscle spasm kind of keeping you from functioning properly. Now, the second therapy we'd like to use is electrical muscle stimulation. Now, this applies a very gentle electrical current to the affected area. It's going to reduce any inflammation or swelling in the low back. It's also going to take those muscle spasms and help them relax a little bit better. And then finally, the third therapy that I'd like to talk about is intersegmental traction therapy. Now, this is a therapy where you kind of lay down and you get traction to your back. Essentially, the therapy is designed to traction the joints away from each other and alleviate any pressure that accumulates and kind of open up a little bit more space so you won't have as much pressure into that area. And this will essentially reduce any restricted motion and reduce any pain in that area as well. So kind of in summary, when these three therapies are used together, you're going to have immediate reduction in pain. It may stop the pain completely. You're going to see better range of motion. You're going to be able to move a little bit easier. You're going to be able to bend and turn a little bit without so many restrictions. And then finally, it's going to reduce any muscle spasms, muscle tension, and just kind of get those muscles to function properly and relax a little bit. So what does this mean to you? This means a couple things. Now, first, you're going to be able to go to work and be able to perform your job duties without so many restrictions. You'll be able to perform them a little bit more effectively. If you're turning or bending or lifting at work, you won't have the same restrictions and you'll be able to perform those activities much easier. You're also going to be able to sleep throughout the night a little bit better. You're going to get a better night's rest. You're going to wake up a little bit easier. It's going to be easier to fall asleep, and you won't wake up constantly through the night if you're bending or turning over during your sleep patterns. And then finally, things that we do on a daily basis. Now, this would be getting up in the morning, getting dressed, brushing our teeth, brushing our hair, even playing with our kids or putting our pants on. when the low back's affected like that, these daily activities can be actually very difficult to do. So we're going to be able to get you back to work. We're going to be able to let you sleep a little bit better throughout the night and also do your daily activities throughout the day. So if you're being affected by low back pain, please give us a call so that we can help. You can reach us at 803 599 5902.